That's a good segue to recognizing Dr. McCormick, emergency physician, who was not here during the height of the pandemic. He was in the emergency department taking care of patients. Dr. McCormick, you recognize.
Thank you, sir. Thank you, Dr. Chair. Appreciate all your hard work in this regard. It's good to see you here today, sir. Thank you for your military service. I appreciate that as well. Take that very seriously. It's interesting that when I was just listening to the other side of the aisle talk about how much money do you need, how much money are you short, I have yet to ever be in a hearing where anybody was ever asked that question and says, I have enough money. We're good. Matter of fact, you can cut my budget, it's fine. It's a great question that's always asked from that side of the aisle. How much more money do you need? The problem is everybody says they need more money. So let's have a realistic talk about what that means. Moving into the future, and as a ER physician, by the way, I appreciate you recognizing that a lot of us had burnout during this last 3-4 years from the beginning of the pandemic, where we're doing our very best. And we're trying to make our case as to how to treat a patient based on our best ability to understand something that nobody had ever seen before, and witnessing thousands of patients that were being treated, and then being told by a government person, whether they be a physician or whatever, somebody who thought they knew better than me, who was treating thousands of patients, how to treat the patient, and saying, I'm going to censor you. I'm going to tell you you're wrong, even though they hadn't treated one patient. That's one of the things that you mentioned as far as the burnout and being underappreciated for what we were trying to accomplish, which is ultimately to take care of that person we're holding the hand of while they may be dying. So thank you for recognizing that. One thing that worries me is that by preparing for the last pandemic, we're not preparing for the next. And we've seen this in warfare, and we're seeing this in a war against a pandemic. And what I'm worried about is the flexibility moving forward and how we best prepare to have a flexible model so we can react to whether it be a bacterial infection, whether it be affecting your lungs or your brain or some other part of your body, or a fungal infection or a viral infection. It doesn't matter. Whatever that next thing that we have to handle, that we have a flexible model that's not all of our eggs in one basket, that we spend billions of dollars patting the pocket of certain people, but to prepare for the last pandemic instead of the next one. My question specifically for you, General Friedrichs. As Director of the Office of Pandemic Preparedness and Response Policy, you also serve as a co-chair of Public Health Emergency Medical Countermeasures Enterprise, which oversees a strategic national stockpile. Based on your time at the Pentagon, I imagine you can attest to the need to coordinate with private industry to advance America's national security interests. In this regard, I thought Trump did a good job with trying to come up with a vaccination at warp speed, if you will, teaming up with private industry to make that happen. I have some concerns about what the Biden administration has done to team up with the private industry to accomplish the same kind of missions and a flexible model moving forward. Can you please discuss the efforts of your office in taking to work this hand-in-hand compilation with private industry to make these kind of flexible models into the future work?
Congressman, thank you very much. And that is one of the charges that we were given when this office was created, and it's one that I take very seriously because there is no pandemic response without our industry partners, without the people who produce the PPE or the vaccines or the therapeutics. So we've spent a great deal of our time in the last 7 months reaching out to industry stakeholders, to different groups that make up larger parts of the industry, the small and the medium-sized manufacturers, meeting with them and listening to what they experienced over the last 4 years so that we can bring that into the report that we're doing and then work on updating our plans. You mentioned Operation Warp Speed, which is, again, a remarkable testimony to what happens when a public-private partnership is created and resourced. And it also is noteworthy that that started in May of 2020. It would be ideal if, working with industry and with our federal and other stakeholders, we can write a plan where that's ready to go in 5 weeks, not in 5 months, because we've develop those partnerships, we've developed plans that understand and lay out how we will collaborate quickly and effectively with all of those stakeholders. And I would hate for anyone to misinterpret my comment. That is not a criticism. I accept responsibility for having been one of those involved in and had the great privilege of standing up Operation Warp Speed. But the reality was that we were building those connections as the pandemic was unfolding, as we were trying to understand exactly what the magnitude of the pandemic would be. What we are going to work on with these industry stakeholders, and we met with several of them as recently as yesterday, is how do we do that as quickly and effectively as possible before the next pandemic, not during it.
Okay, great. And just in conclusion, I just want to stress that we don't need bigger government. We don't need this idea that the government's going to accomplish everything. When we talk about a pandemic or space exploration or AI or anything else, you can see this marriage of government helping private industry take over something in a much more effective and efficient way into the future, I think, is the solution. And this idea that the big brother government gets to decide all the conclusions by itself, by investing all this money for a one-sided view of how we're going to solve a problem instead of empowering the people to solve it, is a false narrative. And I just want to say that the worst thing we can do is grow a government in size and scope to the point where they can tell you what to do with your business, with your medical care, and everything else. This is a decision that people can make, that medical professionals can make far better than the government, and that's the thing I wanted to highlight in my conclusion. With that, I yield. Thank you.